Good afternoon, everyone. I'm Dr. Safdar Zabed, working for Medcare Medical Center in the Discovery Gardens branch. I am a general practitioner, usually seeing all the day-to-day cases with a special interest for diabetes. So today, thank you everyone for joining us with a live session, which we are going to talk about the social distancing and the telemedicines. Since you know the situation is which is going on about the corona pandemic and there is social distancing, most of the people they don't like to prefer to go to the hospitals or clinics so that they should not get exposed to anyone infected, so to get the infection. During this case, it is very important and very easy for everyone to go through the teleconsultation health services. So I would like to say a brief about teleconsultation health services, that any patient at their own comfort, they can contact the doctor, that is through the video over the internet, either that could be over the desktop, laptop, their tablet or the mobile phone, either Android or the iOS. It's very easy and simple to use. So it is through the Cisco app which the patient can connect from any place to the doctor at any time. So all the doctors are available with us. They can contact all our qualified doctors for Medcare. So it is easy. So they can have the consultation, the patient, whatever they have the query and all, they can have ask the doctor, and they can go through the consultation. They have the consultation discussion with the doctor. So the advantage for the teleconsultation is there. They no need to go to the clinic or to the hospital. It is the same process as they go to the clinic, but it's all virtual. The registration will be done. Then after the registration, they will consult the doctor. After the discussion with the doctor, when the doctor feels okay, that can be done over the teleconsultation. It is done. After the consultation, there are many facilities which we are offering to the patients, like a bouquet of facilities, healthcare facilities can be done. Once the consultation is over, the prescription is also prescribed for the diagnostics, sample collection, everything. We have the facilities for that. So this is basically, so everyone has to download the Cisco, and from the Cisco they can proceed and go through the video. The other thing is that if some people have the difficulty in downloading the Cisco, through the phone call also they can have a audio consultation with the doctor, but it will be the same. So this is briefly about the teleconsultation. I would introduce my friend Mr. Anas to go ahead with our live session for the social distancing and telemedicine.
Thank you,
Hi,
doctor.
Mr. Anas.
How are you, doctor?
I'm fine. How are you?
I'm good. I'm good.
Great.
Thank you, doctor, about explaining to us a little bit about the
Most
telemedicine. Doctor, right now in the telemedicine, why would I be interested to do the telemedicine, and how I'm gonna be more comfortable to do it? Can you explain more about that?
Basically, telemedicine is very simple. Like as per the present situation, basically, if anybody has some simple complaints and all, and they don't want to go to the clinic to avoid getting exposed to the more people, or you don't know if anybody is infected and all, they might get infected, and people are having fear. And then there is a concern for the social distancing. So many people are avoiding. So this makes us very easy. So they can, through the teleconsultation, they can have a virtual meeting with the doctor. They can discuss even whatever the points they have concerns, they can write it before, they can talk to the doctor, they can discuss everything. So even after that, if the doctor thinks it's a mild case and all, which can be managed over the teleconsultation, it's very easy. So everything will be done. The consultation is there, and then even if they can monitor their vitals like the temperature, BP, pulse, and all, the consultation.
The patient, if
Yes.
they can.
Yes, if they can. Most of them, they have the glucometers, the BP meters, and they can check the temperature and all. So we can go ahead. And apart from that, there are many cases who have chronic cases who want the refill of the medications.
Yes.
They just want the refill of the medications. So it's very simple for them. So just
How can you elaborate a little bit, doctor? Is how it's simple, because I am a chronic patient,
Right.
and the telemedicine. I want to call the doctor and tell him I need to explain to him all of my case, or when the patient, like I'm existing patient already in
Yes,
Medcare,
right.
so the doctor can see all of my file and
Yes,
re-describe.
definitely. Suppose any of the patient is already registered with Medcare, so all the consultations are already there in the file. So once if the patients, we can go back and check when was the last visit, when was all the medicines were being given and all. So if a patient calls us and says that he is a regular patient of Medcare and all, so we have all the list of the medications which already taking. So he says like for the diabetes, hypertension and whatever the medications are being taken, he will say. So we will just double check. We will say, okay, these are all the medications you are taking. They will confirm it. We will double check with them.
Of
The
course, with
name
the
of the
doctors.
medicines, the dosages and everything, we double check with them. So once everything is there, we will note it down and all. Even the notes of the previous doctors are there. When was the last previous visit and what are the medications the patient was taking. So accordingly, we will just double check and all. We will write down the prescription.
So it is that easy right now that
It's
people.
quite simple. People are learning, and I would say that people are loving it because it's simple, very easy for them. And mostly nowadays, like as you say, the patients with a chronic problem like diabetes, hypertension, heart disease, and other problems, they are advised not to go out to the market and to get exposed in a crowded places. For them, it's an advantage. So sitting at home, anywhere, even from the car, they can make a call, they can request it, and they will get the medicines as required.
Doctor, thank you, but can we go back a little bit and talk about people, how to log in, how easy it is to log in our call? Because you were saying that if it got disrupted by, you cannot link through the Cisco or download the app,
Right.
they can make a call. So can you tell us exactly how to go? They will go to the website first, medcare.ae,
Yes.
and then?
Yes, it's very simple. First of all, anybody, they have to log on to the Medcare AE website. Once they go on the Medcare website is there, accept it. Once they accept it, that will take through the whoever the person is there to download the Cisco Jabber app. It's very simple.
Cisco Jabber.
Yeah, Cisco Jabber. So once they go to the Cisco Jabber app, they will just click it. So they have filled in their details, their name, the email address, and the mobile number. Once they click it, it connects to one of our agent here in the call center.
Yes.
That is specially for the teleconsultation.
It will link for the agent, but it's not gonna be like live yet, or it's gonna link as a phone call.
Possibly this agent, they can have a view for the patient.
Yeah, okay.
They can have a look,
They can
but they
see the
cannot
patient,
see
yes.
to the agent because their
Correct.
camera is not on. It goes to the agent. Once it goes to the agent, then the agent will take in all the details. That like their Emirates ID, the health insurance, everything is there. Once they take all the details and all, once is there, then they will connect to the doctor because we have at a time 4 to 5 doctors available for teleconsultation. So they will connect to the doctor, and whoever is free, it goes directly to them.
Okay.
It's gone. Then the process goes on. So everything is like a person is visiting the clinic, but is going virtually through the computer.
Through the computer,
Yeah,
which
it
is
could
easy.
be I said desktop, laptop, even your mobile phone. Let it be Android or iOS.
Apple.
Yes, anyone. It's very simple.
And doctor, how long does this process will take me that fill the information, like approximately until I reach the doctor? Would it be like with, let's say, 5 minutes?
What I think hardly a 5 minutes and all, because generally, you have to fill in your details. If it's your laptop or your desktop, it will immediately by default take the fillings. Once it takes you to the agent, they won't take much time, because if it's already a registered patient, once they put in the mobile number or detail, they will get all the details. They will take all the details, and whoever doctor is available, they will transfer it to you.
If in case, doctor, another question pops, like if I called and I want only to speak to an Arabic doctor, because you said a couple of doctors will be free.
Yes.
And the doctor is not, there is no Arabic doctor available at the moment.
Right.
So what will happen in that point?
They want any specific Arabic speaking doctor?
They want an Arabic speaking doctor because they might feel more comfortable to explain to him.
Generally, we have doctors here, multilingual doctors,
Correct.
I would say, because we have doctors who speak English, Arabic, Hindi, and other languages are there.
True.
So in that case, for example, if the agent is not sure about the doctor who speaks Arabic or not, they will call and just confirm, doctor, do you speak Arabic or not? That's clarified. Otherwise, they know who are the doctors who speak Arabic and all. They will transfer directly to them. And one more, like I would like to clarify that, like if any of the patient wants one particular doctor,
Yeah,
okay,
wants to see his doctor.
so they will call there, then they will, after giving in all the details, they will tell the agent, I want to speak to that particular doctor, this particular doctor. So they will transfer to that doctor directly. But if that doctor is busy with some other patient, already consultation going on, so they will say that they can wait for some time and all. So once the doctor finishes the consultation, you can try it after 10-15 minutes. So in that consultation, we will connect you to your doctor. You got my point?
Doctor, I got a question right now from somebody.
Yes.
She tried to book an appointment online 2 weeks ago and it didn't work. So I believe sometimes there is glitches.
Right.
But what kind of glitch if somebody couldn't get an appointment for some reason online? What is the second step they need to do?
Generally, I will tell you here in our teleconsultation, they can just connect us directly. There is no appointment for them because we have 4 to 5 doctors already. Everyone there is on their.
So they will call directly 800 Medcare.
No, I mean this is then that is a consultation appointment for the clinic. I'm talking about the telemedicine.
Yeah, but if I try to connect and it didn't work at all, is there a number or an email they should send to it that we try to call them back?
Yes, because once they register and all, they will get the details of here. If the patient is unable to contact us through the internet, I mean through the video call.
Correct.
We have a facility, then the agent will call to that person on their mobile number. That on the mobile number, they will talk and they will take all the details, and through the phone, they will connect it back to the
patient. But if somebody had doctor tried everything, nobody contacted them, is there an email or something they can send to, like info@medcarehospital.com?
Yes, definitely.
So we can say that if anything happened or any problem with the teleconsultation, you can send us an email on info@medcarehospital.
Definitely.
Or call our 800 Medcare and explain to them the situation that they can help you and support you.
Because once they receive the email and all, they will just that email will be passed to the concerned department and all to take the action immediately.
Exactly. But if in case somebody did not get a call, or 2 weeks, the one is saying that 2 weeks ago and it didn't go through, but somebody called her or not, I don't know. So in case she tried and it didn't work, what's our advice is that just call 800 Medcare, our call center, or send an email and we will try to get back to you as soon as possible.
Yeah, sometimes if they had some technical problems and all, we can call the 800 our toll-free number of 800 Medcare, and definitely they will guide and help, because whenever is there to the concerned departments, all the emails will be going to take the appropriate action to help out any of the person having any issues.
Brilliant, doctor. Thank you so much. Now, what I want to ask you is that now I have filled the information, I met the doctor online and everything. So the doctor will prescribe for me the medication. How would I receive my medicine?
Right. So once the consultation is over, the doctor will go ahead and he will write the prescription and they will generate the ERX, which is very necessary, because here without the ERX, nobody will get the medicines. Once the ERX is generated, when the doctor will write the prescription, the ERX is generated. Once the ERX is generated, the agent will immediately email that the prescription to the patient on the email. And the good thing is that we are just working on that, so that for all the patients, so that we can be delivering the medicines directly to every patient. We are still working on it.
We are working on it. We don't deliver until now.
No, until now.
Okay, so basically I will receive my prescription and then I'll need to go and get it somewhere.
Like if you get your prescription, you will go to the closest pharmacy. Just you can give the copy of the prescription, even you can show it on your mobile. The ERX number is important. So once the ERX number is important, they
All
will
right.
get the medicine.
Doctor, again, we have a couple of questions from the
Right.
same lady.
Yes.
Like, as we discussed, if you have an issue and she didn't receive SMS message or anything when she tried to log in, so please send us your mobile number or your contact details through info@medcare or offline through our social media channels, and we can get back to you and check what happened. Regarding your second question is it covered by insurance?
Yes, it is
covered.
covered by the insurance. Those policies which are covered under the Medcare, they are all covered.
All covered.
Yes.
So basically, if you know that you're covered by Medcare,
Yes.
for sure, if you want
They
to
are
use the
covered.
Medcare, for sure you can.
Yes,
It's going to be
right,
covered for you.
right.
All right, doctor.
And I would like to add, like even like somebody, if they want, they do insurance is not. For example, they have to make some 10%, some 20, whatever. It's very simple. So we have a link and all. So the agents will just guide them. They can do the payment that is safe and convenient and very easy. The payment can be done online.
There is payment gateway
Yes,
for
yes,
everyone
yes.
online.
There is a payment gateway, and that's very simple, and everyone is doing that.
All right, doctor. That's very convenient for everyone, and I
Yes.
think it's really easy. So, doctor, is there a specific specialties right now in the telemedicine that people can understand more, like pediatrician? I think
Yes.
we have a gynecology right now
Yes,
for the
yes,
consultation,
yes.
general for
Right,
normal
right,
stuff.
right. Yes.
I don't know. Do we have orthopedic? Or I'm not
Orthopedic,
sure.
as of now, we are just working on it, but
Alright.
all other specialties are available. Like, okay, general practitioners, internal medicine, your pediatrics, gynecology are available. For example, I am a general practitioner, which if I receive a case which I feel it has to be has a consultation with the gynecologist. So I will just request the patient just to be on the line and all. I will call back to the agent because I can see who all the doctors are available.
Correct. Okay, got
Now
it.
on
Now,
tele platform.
Oh, it's
So yes,
systematic.
yeah, doctors, we can see who all doctors are available. I know if the gynecologist is available at that time and all. So I will tell that we will be transferring you back to the specific specialist.
That's very nice, doctor. I didn't know that. So these departments, they can check whatever. But if
Yes.
if the case needed orthopedic doctor,
Definitely.
what's the second step with the telemedicine? I don't want to come to the hospital.
Yes.
I want to see an orthopedic, but it's not available
Right.
for now. What's the second
Right.
step?
So definitely, I'll tell you, if there is any orthopedic, they want a specific orthopedic and all, we are just working on it, that so they can have, like, that will be we will be booking an appointment for the orthopedic doctor. That doctor, possibly he will be there in the clinic and all. A specific slot will be giving to the doctor. Like, suppose he is there in his office.
Yeah.
Right, he is working and he is having a physical patient, then he will be having, like, noted, like, at this particular time he will be having a teleconsultation. So there will not be any appointment for the physical contact with the patient, so they will be contacting,
the doctor will be
video
contacting.
or audio, that will be there with the patient.
I think we have another question as a comment, doctor, that so any of us can see our favorite doctor or our doctor, that even if it's teleconsultation.
Definitely.
Which, as you explained right now, we will ask for them, they will take the requirements and send it to the doctor. Doctor will contact you.
Yes.
Which is very easy. All right, doctor. I believe that it's so simple right now. It's so easy because of the social distancing. And is it safe that, because at the end, doctor, you might request for a lab test or some stuff.
Yes.
So if you ask me to come to the hospital, it's gonna be, how long is the process to come to the hospital and do these things?
See, if the doctor needs, if the doctor thinks that the patient needs investigation, or there are some chronic patients who wants that whatever, after 3 months the labs has to be done.
Required.
So we need the labs. There are two options. One option is there, when we talk to the patient, we will ask which is the closest branch for the patient.
Correct.
Okay.
You can go to any branch.
According to the closest branch. So we will take the approvals and all. Then our agent will fix a specific time and all. So they will just go there, give the sample and leave. No time, no waiting.
No waiting.
No waiting. They will go to the clinic. And even in all our clinics, social distancing is being made. Like, people are not allowed to crowded and all, as per the government rules. Everyone is following that. So there is no crowded and all. Like if the patient has to give a sample in the morning time, so they will be, that particular clinic will be informed that this person is going to come and give the samples at this time. So they are ready for that. Once the patient goes there, just they will show you their number, the ID number and all. Immediately the sample is taken and there the patient has
They
to
can
go.
leave.
Yeah, they can leave.
Doctor, what we're saying is that after we finish the whole consultation, you'll request for a lab test.
Yes.
And then the agent needs to speak again with
Yes, yes.
with the patient.
Yes.
And then coordinate with him about where he
Yes,
wants to do his lab
right.
test or when and these
Right.
things.
Well, sorry for that. I'll just like to interrupt. Like some people, like some of the people, they don't want to go to the clinic or the
Exactly,
hospital,
that
whatever
was
is
my
there.
second question.
Yes. So we have giving the facility as like the sample can be collected from the home.
Yeah,
Yeah.
the sample can be collected from a home.
From
You
the
mean
home,
that
yeah.
we have a facility
Yes.
that is that covered by insurance, doctor?
See, the insurances are covered, the labs are covered by the insurances. There will be extra charge for the nurse to go and collect the sample.
Oh, there is an extra
Yes.
charge just for the nurse
Yes,
to go
for the
home
service.
and
That is
collect,
just a service charge.
which is right now we have it available with us.
It is available. And one more thing, that even now we are working on Fridays also. So our doctors are available on Fridays also.
It's 7 days a week. We're available
Yes,
24
yes,
hours.
yes,
So they can.
yes.
Are we 24 hours? Like
No, not 24 hours. Yes,
huh?
at the present moment we are working from 9 a.m. to 9 p.m.
9 a.m. to 9 p.m. for telemedicine.
Yes, telemedicine.
Anything emergency, they need to go to the
Definitely.
emergency
And in
department.
case, for example, some of the patients, when they call the doctor, so when the doctor feels no, that definitely needs to be a consultation. Okay, yeah, that's it. So if the patient calls the doctor, when the doctor feels that they need to be examined by the doctor, so what we do, we immediately make an appointment at the nearest clinic.
Nearest clinic.
Yeah. So that is our responsibility. Like if the doctor will call back to the agent, this so and so person, he or she needs an appointment at the clinic, you make an appointment. So they will make the nearest appointment with the nearest clinic. Then they will inform that clinic, they will inform the patient and all. So when the patient goes there, there's no much waiting and all. It will be very
simple,
easy,
and he's
for
not
them.
gonna interact. There will be social distancing, of course, because of the appointments.
Everywhere,
so his appointment is blocked.
all the rules and regulations for the social distancing are being followed. So it will be very easy for them. That will not be crowded. So it will be very easy for them. Once, for example, we have taken an appointment for any specific clinic, so that clinic is already informed that so and so person is coming for the consultation over there.
Okay, doctor. Now, one of the questions will be is that one of the patients might require some X-ray, some MRI. So how does it work for the hospitals right now? If you're seeing patient, you need to do for him ultrasound.
This is the same protocol as the doctors are doing in the clinic. The same protocol. Like for example, if the doctor, if any of the consultant or the specialist, they feel like they need to do a X-ray or MRI and all, they have to fill up all the forms. What we have to do? They have to take the approval. Once the approval is taken, then the appointment is fixed. Once the appointment is fixed, then the patient will go and get whatever the procedure is there for the X-ray.
For the X-ray in any of the hospitals or where it's available.
That is subject to the approval.
Subject to the approval, of course, of the insurance.
Yes.
But they need at the end to come to the hospital for these things because we couldn't.
Yes, definitely, because they have to come to the hospital. Only if their blood samples are there and all, then our nurse will go and collect from the house.
All right, doctor, in the teleconsultation now, if I feel like I might be having the symptoms of COVID.
Yes.
Shall I do the teleconsultation or should I just go to the hospital? Because I might be feeling just coughing and I couldn't breathe, but I don't have a fever.
Right.
So it might be a normal thing.
Right.
So what do you recommend in that?
See, generally for the COVID and all, what we say, if anybody not feeling well, better to self-isolate, quarantine at home. Self-isolation is there to take the symptomatic medications, because if there is simple complaints and all, to be at home, self-isolated, and to take the symptomatic medications. Even some of them are concerned, like they want to check for the COVID and all. So there are two options. Once they can call to the DHS sites and all, they can take an appointment, and they can go to the clinic or the hospital, wherever they want, they can go and give the sample also.
Yes, but if you feel like it's mandatory to go to the hospital. It's better to go to the hospital because they need to do the swab.
Yes, yes.
But they can do a teleconsultation in case that they are not sure.
Yes.
And might the doctor. So, doctor, if it's a teleconsultation, just one question that I have.
Yes.
Is that usually when you are meeting a patient or a
Right.
new patient,
Right.
you need to examine the whole body.
Yes.
So how do you manage that through the teleconsultation?
Yes, so that depends clinically. So that depends clinically because with the doctor's experience and all, if like most of them, they say like even they have simple runny nose, simple sneezing, or some headache, body ache, common complaints and all, that can be managed.
That I said that I have a stomach problem, but I cannot see you. It's through telemedicine.
No,
It's
because
better.
if anybody is having stomach problem and all, definitely that has to be evaluated by the concerned specialist or the doctor, because you don't know, because stomach pain has to be evaluated properly before going ahead. Okay, it's simple acidity, dyspepsia and all, that is okay. But if somebody is telling like if there is like stomach pain is there, vomiting is there, anything, definitely we'll try to make an appointment at the nearest place, and that has to be physically evaluated by the concerned doctor, and the decision has to be taken.
That's clear.
Yes.
Thank you, doctor. I finished all of my question. Just to remind everyone that if you have any problems with the teleconsultation, you can clearly contact us through 800 Medcare or send us an info@medcarehospital.com. And through the telemedcare, the teleconsultation, you can request for your favorite doctor or whoever you want. We have everything available as per the doctor apply for us. Thank you, doctor, for the session today.
It was nice. So once again, I would like to encourage everyone for the cases, those who don't want to visit the hospital, have the prescriptions or whatever simple complaints, they can just consult the doctor, any specialties, because all our qualified doctors are available at telemedicine. So we are there to help you. They are there to guide you. So feel comfortable to come through our website and meet our doctors, consult our doctors, and we will be there to help you. So once again, I would like to say I'm Dr. Safdar Zabed, working with Medcare at the Discovery Gardens. So I'm also there at telemedicine. So anybody, you are most welcome to have a consultation with me and any of my colleagues.
Thank you, doctor.
Okay, I wish you all a happy weekend and take care, stay safe, and just follow the rules for the social distancing.